Namaste, I am Dr. Sonali Gautam. I am a consultant gastroenterologist and hepatologist at Airoli Center for Digestion. Today, I am going to discuss about Esophageal Gastro Duodenoscopy, that is OGD-scopy or gastroscopy. So, whenever we want to examine the inner lining from mouth to the stomach and the earliest part of small intestine, then we do an upper GI-scopy, that is gastroscopy. Why do we do it and where do we do it? I'll let you know. First, we'll know how to do it. So, whenever a patient has a history of bleeding from mouth or in the vomit or having an upper abdominal chest pain, so we want to see whether there is swelling or some bleeding ulcers inside. First, we'll know why we want to do a gastroscopy in any patient. So, gastroscopy is usually done in patients who have long history of acidity, probability of ulcers in them, H. pylori infection, or patients who present with blood in their vomit. So we have to go inside and see from where my patient is bleeding. For that, we need a gastroscopy. So when we do a gastroscopy, usually it can be done without any sedation also, and it can be done with sedation also, depending upon patient's characteristic, whether patient is high risk or low risk, whether patient is young or old. In our center, what we do is we usually sedate the patient. It makes the patient calm and allows her to examine the upper part of the stomach and intestine. So we usually sedate the patient for 10 to 15 minutes. We put a machine that is called gastroscope inside the mouth, food pipe into the stomach and proximal, the earliest part of the small intestine, and examine the whole, and it takes approximately minimum to 5 minutes to maximum to 10 minutes. And we go inside and see whether there is any ulcer, whether there is any tumor, whether there is any bleeding point, and if required, we take biopsies for further investigations. It is a very safe procedure, and complications because of gastroscopy is very, very rare. So, whenever your doctor suggests you for a gastroscopy, please go ahead, because he may be suspecting something going inside. Further about gastroscopy, you can contact in the number given below. Thank you.